Hi, I'm Sarah, and today we are going to do the skill of nasogastric tube insertion and removal. So, to get started, we're going to go to the computer here and we're going to look up our physician order and our patient information. Okay, so we have our patient, Morgan Brown, MR number 255205. He has no known allergies. His date of birth is August 4th, 1970. Now let's look down here. I see that he's MPO, and I see there's an order here from today at 15:18 to insert nasogastric tube now, and to insert it to low intermittent suction. So now I'm going to go gather my supplies. We need a pulse ox, a drape or a towel, a stethoscope, a cup with some water and a straw, lubricating spray. If this were an actual patient, we'd be using lubricating gel, but for mannequin purposes, we're using the spray. Oral hygiene sponges, some tape, litmus paper, safety pin with a rubber band, emesis basin, canister with a piston, of course, our NG tube. Now that I have all my supplies, I'm going to go to the patient's room. The other thing that we will need are facial tissues or Kleenex, but those are already in the patient's room. Hi Morgan, it's Sarah, your nurse. I'm here to insert a nasogastric tube into your stomach. The doctor just ordered this. So can you verify your name and date of birth for me? Okay, Morgan Brown, 8470, and I'm just going to verify that that's what we have here. We're going to look up the order again. So Morgan, we're going to put this tube in your stomach today. It's usually used to relieve either a bowel obstruction or extra air from your belly. I see that, let's see here, here's the order to insert nasogastric tube, and then I need to connect it to suction, which is on the wall behind you. And you're not to be having anything by mouth, and you have no known allergies, so that's good. So typically, this type of tube is inserted into a patient that either has a bowel obstruction, they're not able to move through things through their GI system properly, may have too much air trapping in their abdomen that's making them uncomfortable. They may be experiencing nausea, vomiting. So by putting this tube in, it's going to help relieve that air and gastric contents if necessary. So Morgan, I will walk you through everything that I do today. I will admit it's not going to be a very comfortable procedure. So I'm going to put your head up right now, the highest position. Bring you up to a more comfortable level for myself, so I'm not doing a lot of bending. Okay, now I'm going to perform my necessary assessment. So of course I want to listen to the abdomen. Okay, Morgan, it does sound pretty quiet in your belly there, and you do feel a little distended and your tummy's not as soft as it should be. So I think it's a good idea that we go ahead and insert this tube. Okay, so to give you guys an idea of what we're doing today, is we are going to put this tube into his stomach. We want to make sure that we're going down the right pipe. That's always important. So when I say the right pipe, you want to make sure you're going down into the esophagus, because this tube is going to drop down right into his stomach. So it's going to enter through the nose. Then we're going to keep advancing it to the back of the throat, which is the nasopharynx area. Then we're going to continue to pass it down into the stomach, and then that's where we will, if the doctor has ordered, to hook it up to suction, which in this case they do. So I just wanted to give you guys a visual of what we'll be doing today. Okay, all right, Morgan, let's get this started. So I'm going to put this pulse ox on your finger just to monitor your oxygenation. I also want to ask if you have any deviated septum. Want to make sure that you have no nose bleeding here. So I did bring a pen light with me, so I'm going to check out Morgan's nasal passages, make sure there's no facial trauma or anything. Usually, you know, want to try, just kind of investigate, look for the best nair to go down. I am left-handed, so I'm on the left side of the bed. If you were right-handed, you'd be on the right side of the bed. I'm also going to just double check everything in his mouth looks okay. Okay, I'm going to put this blue drape across his chest. Like I said before, you can also use a towel. This is just to prevent from making a mess. So I'm going to get my area all set up. Morgan, if at any point you're having any issues, I want you to put your hand up to let me know. We'll use as a signal that you need me to stop. Okay. I'm going to have you hold this cup with a little, I have poured a little bit of water in there. At one point, I'm going to need you to actually drink from this, but not take any sips quite yet. Just in case if you need to spit up or anything. I'm going to prepare my tape. I'm going to want to split it here. Well. Okay. All right. I should have everything I need. All right, so here I have my tube. It is a 14 French Salem Sump NG tube. Now, I'm going to just show you a few things about this tube. Okay, so this piece right here, very crucial to hooking up to suction. So you don't want to lose this piece. Otherwise, I'm not going to be able to hook this tubing up to him to do what I need it to do. Okay, now this right here is a one-way valve. You never insert anything into this blue tube. This is how air escapes. So always you want to just leave it open like this. Now, what I'm going to do now, what's important so we know how far this needs to go into Morgan, we're going to measure from the tip of the nose to the earlobe, then down to the xiphoid process, okay? Then I want to look, I'm going to mark this with a tape so I know that once I'm going, that I know how far to go in, when to stop, because we're not going to insert this whole tube into him. It's really long. I'm going to curl the end of the tube with my fingers. Now remember, anything GI is not sterile. So if you notice, I'm just, I'm using clean gloves. All right, now I'm going to spray this with the lube. Okay. All right, Morgan, here we go. Now I'm going to have you tilt your head back. We're going to insert the tube. Have you tilt your head back to the pillow. I'm putting the tube back until I hit. You want to make sure too that it's going down the throat and not back through coming out through the mouth. Now once you get to the back of the nasopharynx, Morgan, you're going to tilt your head forward. I'm going to have you take some sips of water while I continue to advance the tube. Okay, you doing okay? All right, you're doing a nice job here, Morgan. A little bit more to go. Okay, I've hit to where my marking is. I just want to put my tape just there so we don't slide out quite yet, because I do need to check that this is in the right spot. So now I'm going to take this connector piece out. Don't lose it. I'm going to draw up 30 milliliters of air. So we're going to check placement. Stick the piston into the tube. I'm going to take my stethoscope and I'm going to listen over the stomach. I'm listening for a gurgling sound. Or a whooshing sound. Okay, good. I heard the whoosh. That means we're in the right spot. Now I'm going to pull back some gastric juices. Okay, and I'm going to take that and I'm going to put that on my litmus paper here. The acidity for gastric juices is between usually a 3 to 4. So you can see that's the color here. So it looks like that I'm in the right spot. So that's good. Morgan, you did a great job. So now I just want to tape this into place. That other piece out of your way there, buddy. Sorry. You want this to secure because it wasn't a comfortable procedure. We don't want to have to put this in more than once. All right, good. All right, now I'm going to take my safety pin with my rubber band, just slip knot. And this is just so it doesn't tug. You can pin it to his gown. You want to give enough slack so the patient can at least turn their head. Okay, now because the doctor did order suction, I need to put this piece back in. Hook it up to suction here. Okay. Now it said low intermittent. So over here on the suction gauge, the low part is this green section. Intermittent is, you should have a continuous or intermittent. So we want to switch over to intermittent. I'm gonna turn the dial, want it to stay in between the green. Now the purpose of that is so it doesn't cause any bleeding or irritation of the gastric lining. We don't want to suck everything out of it or cause any bleeding. So, okay, Morgan, thank you so much. Would you like me to take a little swab here? I can wipe out your mouth a little bit, wet your lips, and then I will be back in a little while to check on you. Go. All right, we're going to keep your head up because that's better for everything to work properly. Clean up my area. Actually, we can. I'm going to put your head down. It looks like you have your call light. You're laying comfortably. I'm going to go to the nurse's station now and I'm going to document everything that I did. Morgan, call if you need anything, okay? Okay, now I'm back at the nurse's station. I'm going to document what we just completed. So I'm going to log in. All right, Morgan Brown. All right, then I'm going to go over here to flow sheets. We're going to do interventions, lines, tubes, drains. Okay, so we put in a gastric tube. So I'm going to add that. Nasogastric tube, insertion, purpose for decompression. Very rarely will these tubes be used for feeding, just so you know. Okay, left nair. It was a 14 French, inserted by myself. I'm going to put Cereborn RN. Placement checked, yes. Surrounding skin is intact within defined limits. Site drainage comments. I had no drainage at that point. Dressing, clean, dry, intact. No residual. No, I had no, I guess I had a little bit of bile backflow. And now I'm going to submit this. Oh, in a comment, I'm going to put that it was placed at 54 for insertion. All right, submit. And we're all set. So now my documentation's complete. So that concludes our skill of nasogastric tube insertion. Hi, I'm back again. We are now going to do nasogastric tube removal. So I'm going to check my patient's chart for an order. Okay, we need Morgan Brown. He's our patient today. Okay, so I have Morgan Brown, MR number 283213. I see he has no known allergies, date of birth August 4th, 1970, admitted with acute appendicitis. And let's see here. Morgan, where's your order? Okay, I see we have an order here to remove his nasogastric tube today, so that's fantastic. We're going to go ahead and do that. Now I'm going to gather my supplies. Right, we want the canister with piston, our litmus paper, a blue pad or towel, saline, or you can use tap water from the sink since the GI system is not sterile. Sponge for oral care. And then some alcohol or adhesive remover we want to make sure that we have. And then facial tissues or Kleenex, which are already in the room. Okay, now I'm ready to go to my patient's room. Hi Morgan, it's Sarah, your nurse. Good news, we get to take that tube out of your nose today. So again, I just want to verify everything. So your name and date of birth, Morgan Brown, August 4th, 1970. So I just want to verify again. I'm going to look in your chart here. Okay. All right, and I see you have no known allergies, so that's good. And I see we have an order here to remove the NG tube today, so that's great. So I'm going to grab my gloves. I'm going to get everything all set up. All right. All right, we're going to turn off this suction. Take you off the suction, turn this back off. Okay, Morgan, I'm gonna take a quick listen to you again. That belly should be making some noises by now if we're ready to take that tube out. And maybe the doctor will let you eat or drink something today. Much better than the other day. Nice and soft, and I hear some noises in there, so it's great news. Okay, so I just need to check a few things first. Put this blue pad over you. Okay. Fill this up with my water, or I can pour my saline in here. I only need 30 milliliters. All right, Morgan, I just want to take a look at everything again. Check out your nose and your mouth. Make sure we have no issues going on here. Everything looks good. Okay. All right, drop my 30 milliliters. Actually, we're going to pull up, we got our 30 milliliters of air first. We're going to do the placement. Check placement first. So again, I have to remove this little plastic connector. Connect to my piston to the tube. Have my stethoscope over the stomach area. Okay, a little bit of air. Whoosh, I hear that whooshing sound. Okay, now I can draw back some gastric secretions. Again, we're double checking that this is in the spot it was supposed to be. Here's my litmus paper. Okay, again, it turns the right color, about an yellowish orangish color. Means that that's positive, the correct pH, which is about 3.5 to 4 for gastric. Gonna drop now 30 milliliters of water. And we're going to flush this tube because when we remove it, we don't want anything spraying out at us. Okay, good. Gonna undo the safety pin here with our rubber band. Okay, we're gonna remove the tape. If the tape is really stuck to his nose, you could use your alcohol adhesive remover. Looks okay here, so I'm gonna release the tape. Okay, now, Morgan, I'm gonna have you take a deep breath, and I'm gonna go ahead and pull this tube out. All right, here we go. All right, good job. Fold that up, everything goes in the garbage. Morgan, you did a great job. Let's make sure you got nothing on your face or anything. Wipe you off here. Give you a little, wet your whistle a little bit here. Okay, and then we'll let the doctor know we got this tube out, and maybe later on today you can eat or drink something, because it means your stomach's working on its own again. Is there anything else I can get you right now? I'm going to put the bed down. It looks like you have your call light. Your side rails are up. You can put your head down now a little bit since you don't have that tube in your nose anymore. Probably a lot more comfortable. All right, Morgan, I'll be back in a little while to check on you. Call if you need anything in the meantime. Gonna go document at the nurse's station now. Okay, now I'm back at the nurse's station. We're gonna document what we just did. So we took out the tube. I'm gonna log back in. NG removal, Morgan Brown. All right, now I'm gonna go back to the flow sheet. Interventions and lines drains where we were the last time. So gastric tube, type nasogastric, action this time is going to be removal. There we go, not removed by patient. Purpose, none, that doesn't apply. Location was left near. We had a 14 French. We did check placement. Surrounding skin was intact within defined limits. At the time, dressing status, clean, dry, intact. So drainage from tube, green. Removed by, I'm going to put my name, Sarah Bourne, RN, and then reason for removal per MD order. And you can put here, patient tolerated well. Okay, and then click submit. And that completes our charting and our skill of nasogastric tube removal.